in psychological care dates back to the time that we found that our own approach, which we'd been working on and developing, wasn't any more effective than anything else. Lo and behold, a review of the literature revealed that the method of treatment that we used was no guarantor of outcome, and it also didn't seem to matter a great deal in the overall picture. So instead of continuing to find the right method for the right client or problem, we decided that maybe it would be a good idea to simply ask clients about their experience. At least if we asked the clients, we'd know in the moment whether what we were doing with them was working or not. And that critically gave us a chance to alter directions, thereby keeping people engaged and hopefully sending them in a better direction. Fit really is agnostic as regard to the particular measurement tools that you use. I would say first and foremost, we need to be measuring, not so that we can aggregate numbers and send them to funders, although that's a side benefit, but rather so that we can be more closely connected with the client's experience. That's important because our experience of the process and the outcome of care doesn't always match up with our clients. Now, why use the ORS and SRS? That's certainly not where I started. The tools that I originally used were much longer and required much more of the client, both in terms of time and reading ability. So we developed these short, brief tools so that it would first and foremost cut across a wide variety of presenting concerns and problems. And secondly, it would fit many, many clients. And the truth is, you don't always need an MRI, so to speak. Sometimes a stethoscope is just as good. There are three key aspects to choosing a tool to use to measure either the alliance or outcome, both of which are big predictors of whether or not the client is going to stay engaged for long enough to be helped. They have to be valid, number one. In other words, they have to measure what we want to measure. Number two, they have to be reliable, meaning that you can count on them to over time to give you the same basic feedback. And the third is they have to be feasible. We have a lot of research summarized in now scores of research studies that we have done and outside researchers have done, showing that the ORS and SRS are really all three valid, reliable, and feasible tools. Is it really tough for clinicians to integrate measures into their clinical work? What I would say is it's disruptive. Number two, it's deceptively simple. After all, most of the tools currently in use around the world are between 4 and 10 or 15 questions. Well, how hard could that be? Let me tell you, it's hard because it's likely to disrupt the way you work. It will take time to integrate the measures at the front end of your session, as well as setting aside time perhaps to discuss the client's feedback at the end of the visit. In addition, it may point to when you're not being effective, thereby pushing you to have to spend time thinking about what am I going to do with this particular client. So easy? No. Disruptive? Yes. Hard? Well, I think it's worth the effort to make the accommodation given what the research literature indicates. The reason you would want to use a system that administers and scores the measures is not because it administers and scores the measures, but rather it allows you to compare the progress and experience of the relationship of the client in your room at a particular time to data gathered on millions now of completed cases of care around the globe in diverse settings. It's the ability to compare client progress to these established, we call them treatment response trajectories, that is the real value added in the feedback informed treatment process. Otherwise, you're really relying on averages. Is my client at a clinical cutoff? Are they experiencing the average amount of change? The difference with the fit trajectories are that they are saying for this particular client with these qualities and this level of distress or well-being, this is the amount of change they should be seeing from visit to visit. And that's fairly revolutionary.